What are some ways you help your patients manage side effects from PAH medications?
This is such a tremendous question because we in the medical field do understand that being on therapies, whether it be for pulmonary hypertension or for another underlying disease, is difficult, right? Having to refill those medications, needing to understand what those medications might make you feel like, or what to do if you feel unwell because of it. And when it comes to PAH medications, we do know that each of the medication classes potentially has the ability to give patients side effects. And I tend to talk to my patients and explain to them they're not per se side effects, they are often expected results of these medications that are opening blood vessels or dilating blood vessels or helping to decrease those pressures within the blood vessels and the right side of the heart. And because we do know somewhat what to expect from each of the different classes of medications, the most important thing for me is to educate my patients about what they might experience. One, I always feel like when you have a sense of why something is happening to you, you're better able to deal with it. When individuals feel like, oh, I was expected to maybe have a headache or to have some nausea, and I've been given means to combat those side effects, so you can anticipate what you might need to do or who you might need to call. That's going to be the most important thing. So, if a medication is being recommended to you, please make sure to discuss with your healthcare team what you might need to be able to expect. And then once you do know that, ask about what it is you might be able to do to prevent that. And so I think that the best way to manage side effects is to go in with expectations of the potential of having something that makes you feel differently or unwell and what you may be able to do to combat those. Because many of these medications have not only been around for quite some time, and even our newer medication, because of our clinical trials, we are very well versed in what those symptoms might be or side effects might be. And so I would say that for me, this is a huge piece of being able to take care of patients with PAH is making sure that I am giving them the education and information to be able to understand how they feel, why they feel that way, and what they might be able to do to feel better.